Okay, it's recording. This might be too short, I'm almost wondering. Talk really slow. Alright, so thanks everybody for coming this afternoon for this. I really appreciate it. As you all know, my name is Sarah, and I've been doing my placement here. I'm going to be doing my presentation on OxyContin today. It's a narcotic. So before I start, I just want to open up the floor to any discussion that anything anybody might know about this drug.
Highly addictive.
Yes.
I know it's used not prescribed, like people are paying other people to either steal it from pharmacies or to find a way to get it prescribed and steal it from someone else who has it as a prescription.
Okay, thanks you so much. So I hope to cover some more about that, some more in depth. So I'm just going to be talking a little bit about the history, some of the symptoms, some of the functions that it may have on your body, as well as, most importantly, treatment plans. So I don't want to just focus on all the negative, let's talk about what we can do about it. So to start, I just have a YouTube video just to go into some of the things I'm going to be talking about, and I'll expand. So I'm just going to, hopefully this will work.
Rise of opium use at the turn of the 19th century, the German pharmacist extracted morphine from opium as a non-addictive analgesic in cure for opium abuse. But when morphine was also found to be extremely addictive in the mid-1800s, Bayer, in their quest to develop a less addictive alternative to morphine, created heroin. What they didn't realize was that heroin was much more potent and addictive than morphine. When heroin was pulled from the market in the early 1900s, a group of German scientists developed OxyContin, a semi-synthetic opioid derived from a poppy plant they hoped would be less addictive and would form the basis of many painkillers. For years, pharmaceutical companies developed drugs such as Percodan and Percocet that mixed a smaller dosage of OxyContin with larger doses of milder painkillers like aspirin or acetaminophen. But in 1996, Purdue Pharma released OxyContin. Although this drug contained a much higher concentration of OxyContin than previous painkillers, the FDA approved it because the pill is designed to slowly release the drug over an extended period of time. Unfortunately, users soon found a way to break the slow release feature by crushing the pill and snorting or injecting it to obtain a high. By 2010, OxyContin was the second most abused prescription drug in the nation, causing Purdue Pharma to reformulate OxyContin to make it crush and injection resistant. While this new version has caused deliberate misuse of OxyContin to decrease, many believe that former OxyContin abusers have abandoned the pill for a cheaper, easier fix from heroin. Despite the attempts to make OxyContin safer, it remains a potentially addictive drug, even for people who are using it legitimately. Why is this? OxyContin numbs pain by mimicking your body's natural endorphins. The longer you take opioids, the less endorphins your body produces naturally. This is why you feel so depressed when you quit using it. You end up needing more pills just to feel normal. Although OxyContin creates a feeling of drowsiness, relief from pain, relaxation, sedation, or inhibitions and euphoria, users may experience negative side effects. You don't have to purposely abuse OxyContin to be affected by it. Maybe you've been really careful with your prescribed dosage, but you, or your family and friends, have noticed that you've been acting really differently. It's not like you're going far beyond your dosage. Moodiness, fatigue, and anxiety may point to opioid dependence, and opioid dependence includes the risk of overdose. Because you get such a high concentration of opioids, it's much easier to overdose on OxyContin than other painkillers. When you overdose, OxyContin slows down your central nervous system, forcing your heart rate and breathing to slow, which can induce a state of coma or death. And if you mix alcohol with OxyContin, you increase the risk of overdose exponentially. OxyContin abuse and addiction does not go away on its own. Because withdrawing from an opioid like OxyContin is extremely painful, it is not recommended that you detox on your own. If you or a loved one is struggling with OxyContin use, please call us today.
It's very interesting.
Yeah.
To get the historical background.
Well, I'm glad you think so, because I'm going to go more into that. So I'm going to go more in, I'm going to kind of go over again what some of the things, the points that the video made, as well as some extra things that I've come upon in my research. So as the video said, OxyContin was developed in the 1900s in Germany. So the scientists were looking for a less addictive painkiller after being unsuccessful with opium, morphine, and heroin. So OxyContin, which is the main drug in OxyContin, This is what was developed in the 1900s. It's mixed in smaller dosages with milder painkillers, such as aspirin, to make drugs like Percocet. So OxyContin didn't come out actually until 1996, and it was developed by Purdue Pharma. So it works by slowly releasing it into your body to help with the pain. And there's higher amounts of OxyContin in this drug than previous painkillers, and it is FDA approved. So quickly this drug became highly misused and a highly addictive substance due to the high amounts of opiates in it. And by 2010, as the video said, it was one of the top misused drugs in the nation. The drug could be released faster by being crushed and snorted or injected into the body, this allowing the users to get the effect faster and stronger. Purdue Pharma then adjusted the drug to make it less usable and creating it so it could be crush and injection resistant. So now we're going to talk about what does the effects of it, so what does it do? So OxyContin is a narcotic. The definition that I found for narcotic is a drug or another substance affecting your mood or behavior and sold for non-medical purposes, especially legal ones. It works by mimicking the endorphins in your body, which makes your body produce less endorphins naturally. When you quit, your body struggles to make endorphins, which can lead to feeling depressed, and you need to continue to take OxyContin in order to replace the missing endorphins to just feel normal again. This is how it affects your functioning.
So are you saying it sort of hijacks the body's normal ability to produce endorphins?
Yeah, so the more that you take it, the less your body actually makes the endorphins on its own. So that's why when you stop taking the drug itself, your body's not making the same amount of endorphins it was previously. And so it affects the user because they're not feeling as normal as they did
So a dip
before.
in mood then.
Yeah, and the body also builds a tolerance to it. So the more you take, the more you need to get the original high. Is that good? Does that suffice?
Excellent.
So how it affects your functioning. OxyContin, as I've said many times, can be taken orally. It can be crushed and snorted or injected. So orally is a slow release because it's going into your stomach. It's being digested by your stomach and slowly released in your body to help with the pain. And this is how it's intended to be used. This is when it'll be prescribed by a doctor. This is quite a common drug to be prescribed. My own grandmother just had it prescribed to her after her knee surgery. So when it's taken appropriately and therapeutically, it works as it should. However, people have found that when it gets crushed or injected and snorted, it allows the drug to get into the bloodstream quickly because it doesn't have to bypass your stomach, it just goes straight into your system, and so then it has a stronger impact. So as I've said, it doesn't numb pain by mimicking your body's natural endorphins, so that's how it would work. So it gives that relief from pain. It also causes relaxation and sedation. It lowers inhibitions and has sensations of euphoria. So these would all be sensations that would be desirable to users. However, there are negative side effects. These include nausea, dizziness, an altered mental state, confusion, vomiting, and even a fatal overdose is possible. So some of the street names that you might hear being called is cotton, pills, kickers, OxyContin, Ox, OCs, Orange County, Oxys, killers, beans, and rushbow. So especially in our work, this might be the conversations we would be hearing with some of the people that we work with rather than the pharmaceutical name of OxyContin. Okay, so signs and symptoms of influence. So this is how somebody may be acting if they are addicted to the substance. So even individuals who take OxyContin therapeutically and carefully as prescribed can become addicted, again because of that high concentration of the opioids in it. It can be very addictive. And it's easier to overdose with OxyContin due to these higher dosages compared to the other painkillers. OxyContin has a high amount of opiates, which makes it highly addictive. And some of the symptoms that you might see in someone who's become dependent would be moodiness, they'll be really tired, and they might be feeling more anxious than you've ever really seen them before, so that also increases. So withdrawal. So withdrawal symptoms all depend on the length and time that the individual has taken OxyContin, as well as the dosage. As I mentioned before, you do develop a tolerance to it, so the more you take, the more times you do it, the less impact it's going to have, so you have to keep taking more and more to experience that rush. So with withdrawal, individuals who have taken OxyContin therapeutically have reported symptoms that feel like a mild flu. So sometimes people who are getting off of it may not even realize that they were going through a withdrawal. Early symptoms of the OxyContin withdrawal would include agitation, anxiety, muscle aches, increased tearing, insomnia, a runny nose, sweating, and yawning. And then later symptoms of OxyContin withdrawal would include abdominal cramps, diarrhea, dilated pupils, goosebumps, nausea, and vomiting. So these symptoms are very uncomfortable, but luckily they're not necessarily going to be life-threatening. However, the biggest risk is when the user has recently stopped taking OxyContin, but then decides to take it again, because the body's built up a tolerance, and then they just went through a withdrawal, but then what happens when they decide to retake it is that just a smaller dosage could be lethal, and that's actually where they're finding most of the fatal overdoses, is within people who have stopped taking it and decide to take it again.
So a relapse. Puts users or former users at a greater risk.
Yes, absolutely. So OxyContin, the way that an overdose would work is that the OxyContin actually slows down your central nervous system, causing your heart rates to slow, which could lead to a coma or death. So an impact of the substance on pregnancy. So if a mother is taking OxyContin while she's pregnant with her baby, it's very similar, that it will impact the baby similar to alcohol that we've seen. So even a small dosage of the OxyContin can have a huge impact on the newborn, since they're very sensitive to even the smallest dosages of a narcotic. It may cause respiratory depression, and newborns may be born addicted to the substance and suffer withdrawal symptoms, such as convulsions, irritability, excessive crying, tremors, hyperactive reflexes, a fever, vomiting, sneezing, and yawning. Even breastfeeding while taking OxyContin can cause health problems for the child.
Did you say that OxyContin goes through the placenta?
I'm not sure.
Just through the bloodstream, through the umbilical cord?
I'm not quite sure the route it would take, but it's something we could look together after.
Okay.
So we can all know about that.
Thank you.
No problem. So I have 2 treatment options, but there's obviously many. The 2 that I found the first one is Forecast. So Forecast is situated in Peterborough and the Kawarthas, where I go to school. They offer counseling services for the user as well as their family to work as a unit to help with the process. They have a 5-stage program that looks beyond the addiction and deeper into who the person is and perhaps why they're making these choices, what they're looking for. The 5 stages in this order are contemplators, preparation, action, maintenance, and relapse. The second treatment option is Canada Rehab. Canada Rehab employs only certified chemical dependency counselors, which is really excellent because they really do have the education behind them. They've gone to school for this, so they really will have a better and more thorough knowledge of what's going on. And so this is obviously because they want to provide the best care possible for their clients. So Canada Rehab has over 150 different types of treatment options to help you be successful. As quoted on their website, Canada Drug Rehab provides a Gradius referral system, service to the substance abuse treatment, inpatient rehabilitation facilities, and long-term residential rehab. They also aid with the selection of intervention coaching. So I will be giving you guys a handout at the end of this presentation that will have the websites to these rehab facilities, so if you want to get more information on them. Another thing that they both covered was that a huge step to helping someone accept the treatment that they need is to accept that they need the help. It's very difficult to work with somebody if they themselves aren't ready to make that step, because it's a huge step. So it's really important that them themselves are ready to admit that they do need the help.
I didn't quite catch it. Is intervention, like, is it, if not intervention, but if they do admit they need help, is it funded? Like, how, is it free to go?
These are funded, actually.
They're funded.
They are funded by the government, yeah. Especially Canada Rehab, I remember reading that. Again, there will be the websites on the handouts, so we can look more into that. Okay, thanks for your question. I'm going to move now into the trivia. So hopefully you guys are paying attention. And yeah, and I do have a little prize at the end of it. So I'm just going to sit up here so I can read it and look at all your faces. So my first question is if you could name 3 street names that OxyContin goes by.
OC.
Orange County, pills.
Cotton?
Ooh, yes.
Ox.
Ox, yeah.
I think you guys got all of them. Everybody.
There was one with an R. Rushbow.
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 I've never heard
Yeah,
of that.
that was the first one. I've always heard of Oxy or cotton as in like your clothing cotton, but yeah, not Rushbow. So how were drugs like Percocet, so that was talking more the history part of things, how were drugs like that made?
They come from the poppy plant. Originally, opiums derived from poppy plants. And
Are mixed with other drugs like aspirin
Yeah.
to create something like Percocet.
Yeah, so what I have here is they would take a small dosage of the OxyContin, which does derive from the poppy plant, and they would add it to a larger drug like the aspirin to make Percocet.
well, good joint answer.
Yeah, I don't know how I'm going to divide the one prize now.
I think we all
figure it
have to draw straws or something. Pick a number.
What is the name of the company that developed and altered OxyContin?
Purdue Pharma?
Yes.
Wow.
Yes.
Patricia.
Do you remember what year they developed it?
1996.
Nice.
Wow.
Good job. Okay. So how can it be administered other than orally, and why is this dangerous?
Snorted.
Injected.
It doesn't get processed through the digestion system. It goes directly to the bloodstream.
So it does create a stronger rush.
Mm-hmm.
Yay. And how does the OxyContin work? So what's it replacing? How's your body using
It
it?
slows down the central nervous system.
Mm-hmm.
And
It
Releases endorphins into your body to help with the pain.
Yeah.
it actually mimics the release of endorphins, so it slows down the production of your own endorphins.
Correct. So name 2 negative side effects of withdrawal.
Vomiting, diarrhea, dizziness.
Abdominal cramps, nausea,
the flu.
Symptoms of the flu,
Sometimes
yes.
it comes.
moodiness.
Goosebumps.
That's my next question.
Oh, okay.
Good job, though. But just to go along with that one, could you guys categorize that if it's an early symptom or a later symptom? So the one like abdominal cramps, is that early symptoms of withdrawal or more of a later symptom?
Later symptom.
Yes. Good job. So then my next one is just 2 negative side effects of someone who is using it. So as you said,
They're moody.
the
and
moodiness.
Confusion.
They could
Isn't
be
it? I
confused.
think confusion was one.
Moodiness.
Yeah.
Was dizziness one?
No, it would have been anxiety,
I was going to say
And
they
they
get
would've
really stressed.
really tired.
Oh,
Okay.
fatigue, yeah.
The fatigue. So I'd like you to discuss a few issues a newborn may have if their mother was using OxyContin while she was pregnant or while she's breastfeeding.
Convulsions.
So they can become addicted, and
Yes.
the withdrawal symptoms would be, yes, convulsions.
Well, they could have similar
Yeah.
kinds of symptoms to an adult. They could have chronic crying from having cramps or whatever their body's going through.
From being nauseous, being like vomiting.
Yeah. Fevers.
Increased startle response.
You
Yeah.
mentioned something about their mood or mood changes or
Yeah.
something that's